Excellent. Good morning or good noon, everybody. It is excellent to see everyone here. We have a total of 65 people on the call, and we're in the waiting room right now or on the Zoom. And I know that you are all probably as excited as I am to hear about this topic today. Childcare has been a critical issue and will continue to be a critical issue in many of our communities over the next 5 to 10 years. Most likely. So we are very excited today to welcome Dr. Alejandra Ros Pilarz, who will discuss early care and education landscape in Wisconsin, how it's changed over the past 15 years, and the implications of these changes for children and families. Dr. Pilarz will discuss the current state of early childhood care and education workforce, as well as the challenges and the opportunities for supporting the workforce and strengthening our early care system in the state. So please allow me to welcome, we're very excited to have you here, Dr. Pilarz. The screen is all yours.
Thank you so much. I'm happy to be here and excited to talk about this topic that is very near and dear to me. I'm going to share my slides with you. All right. Everybody see my screen okay? Okay, great. So yeah, thanks so much for having me here. So I'm going to talk in 30 minutes as quickly as I can about the state of early care education in Wisconsin, and thinking through both the current challenges as well as giving some ideas for opportunities to better support early care education providers. So some of the, briefly, I just want to acknowledge that some of the data and findings that I'm going to be showing you today come from 2 projects that were conducted in partnership with the Wisconsin Department of Children and Families, and funded by the U.S. Department of Health and Human Services with the goal of improving isECE in the state. So I just want to briefly acknowledge the staff at DCF and the research team at UW-Madison for hard work that went into generating the data and findings from today. And all views are my own, of course. So before I dive into the state of early care education, I want to remind us briefly about why isECE, early care education, is so important and why we're talking about it today. So there's a wealth of evidence that high quality and affordable early care and education promotes children's development, parents' ability to work, and ultimately fuels the economy at large. Children who attend high quality isECE, especially children from families with low incomes, do better in school, are more likely to graduate high school and attend college. And they also tend to be in better health and have higher earnings in adulthood. And these gains then have positive spillovers to the economy as well, and society at large. High quality and affordable isECE is also critical for parents, especially mothers' ability to work. I think everyone's well aware of this since the pandemic started. When isECE is unavailable or parents feel it's unsafe or low quality, they will leave the labor force, which is detrimental to their earnings in the short and long term, and also negatively impacts the economy when employers can't find workers or have high turnover. And so we know that parents were leaving the labor force due to childcare costs and availability even before the pandemic, but things have only gotten more challenging. And then, so before I move on, I want to briefly say what I mean by high quality early care education. So high quality care is really all about the quality of the interactions between children and their caregivers, as well as the provision of a safe and nurturing, stimulating environment for children to explore. So children thrive when their caregivers are sensitive and responsive to their needs, and engage them in ways that stimulate their learning and curiosity. So isECE providers are really the most important ingredient of high quality care. And so what do I mean when I talk about early care and education? I want to briefly mention the different variety of types of settings that we mean when we say isECE or early care and education. So this includes the center-based sector, which is often what people think about first. So including private centers, organizations, nonprofit and for-profit that provide these services, as well as publicly funded public pre-kindergarten programs like 4K in Wisconsin, as well as Head Start programs that are federally funded. And then we have the home-based sector, which includes these 3 groups of family childcare providers, which are providers who are licensed to care for a small group of children in their home, as well as individual non-relative providers could be like nannies who care for 1 or a few children. These can be regulated or unregulated. And then children's relatives are often a key part of childcare system. They often provide regular care, often unpaid as well as paid. So each of these settings can provide high quality care, but typically licensed settings, center-based settings tend to be on average of higher quality compared to unlicensed and unregulated settings. By the time that children enter school, most of them will have participated in some sort of early care and education program, again, thinking of these different sectors and settings. So at any point in time, about 50% of infants and toddlers and 63% of 3 to 5 year old children attend some sort of regular ECE program. So looking at what this participation looks like at the national level, we know that majority of infants and toddlers are actually in a home-based type of program. That's this orange bar right here, compared to only about 30% of preschoolers. Preschoolers are much more likely to be in some sort of center-based setting, again, could be public pre-kindergarten, compared to only about 25% of infants and toddlers. So these differences by age are likely driven both because parents tend to prefer home-based settings when children are younger, as well as many more center-based settings available when for preschoolers once children turn 3 years old and become eligible for other types of programs. And ECE is a large budget item for families, so this may not come as a surprise to anybody, but families spend a significant portion of their income on childcare. So from households with children under age 13, they typically spend about 20% of their income on ECE. And this differs by family income. So among the lowest income households with incomes below the poverty line, they're spending about 33% of their monthly income on early care and education. Again, this decreases as family income goes up. The highest income households are only spending about 11% of their income. Still a significant portion, but much less than a third. Okay, so now that I've given you kind of a layout of what ECE is and affordability of ECE, quality of ECE, I want to talk more specifically now about Wisconsin and what we know about access to ECE in Wisconsin. So what this map, this really cool map shows you is geographic access to ECE for families with children under age 5. And this was pre-pandemic time, so this is from February of 2020. And the map includes all regulated childcare providers. So again, think about those settings that I just talked about. That would be like licensed centers, licensed family childcare homes, as well as individuals who are regulated by the state to provide care for small groups of children. So on this map, each dot represents one household with children under age 5. And then the color of the dots, see the legend up here, tell you how much access to ECE that household has. So the blue and green dots mean that they have better access to ECE, that there's between 3 or fewer children per childcare spot, whereas the orange and red dots represent childcare deserts. So that means that there's about 3 to 5 or more children per childcare spot available to that household. So what you can see from the map is that there's more there's more dots in urban areas, so like Milwaukee and Madison, up here Eau Claire, right? There's more dots concentrated in urban areas, but there's also more blue and green dots in urban areas. So typically, urban areas have higher access to care. So for example, on average, there's 1.7 children per spot in urban areas compared to 3.4 children per spot in rural areas. So so, across the state, on average, this is the pattern that we see. And again, this is pre-pandemic, so due to provider closures and sort of general more difficulty finding care, since 2020, things have probably look a little bit different. And I also want to point out that this tells us again about geographic access, so how close providers are, but it doesn't tell us about the affordability of care for families or the quality of that care. Okay, so I just showed you kind of the current or at least pre-pandemic state of ECE, and I want to talk a little bit about how the supply of ECE has changed over the past 15 years, because this can help us understand if access might be getting better or worse over time. So what we did for this study is we looked at licensed ECE supply. So this includes licensed center-based care, which is this orange line, and then licensed family childcare, which is this blue line. So what we're looking at here is the number of licensed slots that are available across these different types of providers in the state, in the whole state of Wisconsin. So what you can see from this figure is that the total supply, which is this gray line, has been fairly steady. It's declined a little bit by 1.6% slots. But we see pretty big differences in terms of the trends for center-based providers, where capacity has increased by about 10%, whereas for licensed family childcare, the capacity in this sector has decreased by about 50%. So you can see there's fewer family childcare providers. They serve fewer kids, so it's fewer capacity, but it's also decreased by a greater percentage. This is, somewhat concerning because, it means that that providers are serving fewer kids. Again, this is capacity. This is all the kids that they could possibly serve. But if providers are under enrolled because they can't find teachers, or they can't find staff for the programs, then we might be actually serving fewer kids than what this is showing us. And so then I want to point out some differences by region and rurality. So what this figure shows you is the percent change in licensed capacity, again, for all licensed programs, which is the blue bars. So I mentioned a slight decline in the state. And then the orange bar is licensed center-based, and the gray bar is licensed family childcare. So this is what I just showed you. These bars right here for Wisconsin are what I just showed you in the figure over time. What I want to point out here is that in the northeastern, northern, and southeastern regions, these regions saw an overall decline in capacity, consistent with what we see in the state. Whereas in the western and the southern regions, we actually saw an increase in capacity, which you can see these blue bars are above zero. But the increase was really driven entirely by this increase in center-based, which are these orange bars. In rural counties, in most rural counties, we saw an overall decline in capacity of about 20%, so much, much larger than for the state as a whole. And this was driven by a decline both in center-based and in family childcare capacity. The other thing that's striking is that we see these gray bars are large and negative across all parts of the state, and that's really consistent that we see this large decline in family childcare providers across all counties. Only 3 counties did not see a decline in the state. So to try to understand this better, we also looked at the number of family childcare providers that opened and closed in each year. So what I'm showing you here is the number of openings and closings, with the blue bars openings, the orange bars closings. And so what I want to point out is that before 2009, these bars right here, you see a pretty even number of provider openings and closings for family childcare. And starting in 2009, this orange bar is larger, which means we see many more closings than openings in each year, which is likely driving these declines in capacity in family childcare. This is stabilized in recent years, but it's still more closings than openings in each year. And so I'm just showing you for comparison the center-based licensed childcare center openings and closings. And these look much more even, stable across years, much more even numbers of providers who are opening and closing. So the reason I'm showing this to you is because I think this tells us that it's important to pay attention not only to retaining current providers, but also thinking about encouraging providers to enter the field, because we see, again, that it's really the decline in openings that seem to be driving this decline in family childcare. Okay, so what does this mean? What are the implications of these trends? And access to licensed isECE has declined in rural counties in the northern and northeastern parts of the state, which are also, like I showed you in the map, the places that are most likely to have childcare deserts with low access to isECE. This large decline in family childcare most likely impacts families who are most likely to rely on this type of care. This includes families with infants and toddlers, those with lower incomes who are better able to afford family childcare compared to center-based care, families where parents work non-standard hours when family childcare is more likely to be available, families of color and immigrant families, families in rural areas who are more likely to live in childcare deserts. So the decline in family childcare means that families who depend on this type of care might be either leaving the labor force or putting their children in unregulated and potentially lower quality settings, right? Which again has negative implications for parental employment, children's development, as well as the economy. And I want to point out that, although we see relative stability in the center-based sector, when we look at family childcare provider leaving the field, we can actually see that they close their business. But for center-based sector, when a teacher leaves the field, we can't really see that in our data, right? Because it's not like the center closes, it's just that they have to find a teacher to replace the teacher who left. So we know from other states that there's substantial turnover within the isECE center-based sector as well. So the relative stability that we're seeing in these trends over time is likely masking instability in terms of teacher turnover within the field. Okay, so what might explain this? What might be going on? Well, the short answer is we don't exactly know why family childcare has declined in Wisconsin, but we are working on it. We have one of our research teams is working on addressing this question and thinking about in Wisconsin, what are the factors that are driving these changes in supply? But we do know from other research that there's likely several factors at play. So one thing is, as you know, likely know, Wisconsin has an aging population. So one explanation could be a decline in the number of kids who need childcare. So this could be contributing to decline in family childcare. But we also see that the decline is substantial enough that this is unlikely to be the sole or potentially the main explanation. We know from research of family childcare providers who have left the field, the researchers conduct an interview with them to try to find out why they've left, factors that are driving them to leave. We know that these providers describe multiple factors. So this includes things like costly and burdensome requirements from licensing and childcare subsidy programs, low payment rates from childcare subsidies and from families, unstable enrollment of children, things that make their business unsustainable in the long term. And they've also cited, limited benefits and difficult working conditions as contributing to why they're leaving the field. So it's likely that there's a combination of increases in costs and burden of providing care due to more regulations, and coupled with the declining value in subsidy reimbursement rates and the low wages in the field. So these two things sort of are double whammy that might drive providers to be more likely to be leaving the field in recent years, or also not entering the field. So what I can tell you though, about what we do know is from our research in Wisconsin is about the current state of the EC workforce and some of the challenges that they are currently experiencing, which might help us understand again why providers are leaving the field. So what I want to talk about next is a series of studies that our research team at UW-Madison conducted in late 2020, early 2021 on the early care and education workforce. So including a survey of center-based EC teachers and then a survey of regulated family childcare providers. So who works in ECE? So we see here the majority, or nearly all, I shouldn't even say majority. So pretty much all of the workforce is female, 98% of teachers, 100% of family providers. The racial and ethnic composition of center-based teachers are quite similar to those of the state as a whole, demographics of the state as a whole, but family providers are disproportionately likely to be women of color. So more, particularly more Black women working in family childcare compared to their representation in the state as a whole. Early care education workers are also highly educated and experienced. So on average, teachers have 7 years of experience compared to 15 years for family childcare providers. 83% in both groups have some college education, so more than a high school degree, and about 40 to 50% have a degree, either an associate's or bachelor's degree. So, so compared to the state as a whole, they're highly educated and experienced. Despite these qualifications, the early care education workforce is low paid and receives low compensation. So this figure shows you the median wages for regulated family childcare providers for center-based EC teachers compared to Wisconsin workers who have a high school degree. Given the hours worked and the income that they report, family childcare providers are making just above the $7.25 minimum wage and making about $7.50 an hour. And then center-based teachers are making significantly more than that, close to $13 an hour, but substantially less than Wisconsin workers with a high school degree. And as I just mentioned, the vast majority have more than a high school degree. So relative to their education level, they're receiving much lower earnings and wages. In terms of benefits, we also see relatively limited access to benefits. So about 1 in 5 teachers receives health insurance through their ECE job. But about 12% have no insurance at all, and about 8% of family providers also have no health insurance. And also only about 52%, so about half of teachers have some sort of paid sick leave from their ECE job. Perhaps not surprisingly then, we see relatively high levels of food insecurity. So food insecurity is one way to look at the economic security of households. So 27% of teachers, 20% of family providers report food insecurity, meaning that they were worried that their food would run out in their household before they were able to buy more food. So given this challenging working conditions, we think these conditions contribute at least in part to ECE workers' dissatisfaction with their ECE job and field. So one of the ways we looked at their satisfaction with the field and with their job was by asking them about their intentions to leave and why they intend to leave the field or their job in the next few years. So 18% of family childcare providers and 28% of teachers say that they plan to leave the field within the next 2 years. And an additional 20% in each group plan to leave within 5 years. So for ECE teachers, that's about half saying that they plan to leave within the next 5 years. And the most common reason for wanting to leave the field, other than retirement, was to find a job with better compensation or with more opportunity for advancement. And family childcare providers were more likely to say that they were planning to leave for retirement compared to ECE teachers. And then we also asked ECE teachers about whether they had looked for a new job in the past 6 months. We found that about 28% had said that they looked for a new job in the past 6 months. Only about 22% had been in their job for less than a year. So even though we didn't actually measure turnover in the study, we find what we are finding suggests that there's likely substantial turnover in the field, which again is potentially detrimental to providers' ability to provide high quality care as well as to children's development. So one question that we often get is, okay, I've just told you that ECE workers' wages are so low, but earlier I told you that families also can't afford ECE. So what's the disconnect? Why are wages low while families cannot afford care? So the short answer is that ECE is a labor-intensive service. And as I mentioned, ECE teachers are the most important ingredient of high quality care. So we need highly qualified and capable teachers to be in our classrooms to be providing care, but it is very labor intensive. So the vast majority of childcare centers and providers' expenses go towards worker salaries, but they also have lots of other expenses too, and programs operate on really razor thin margins. So to illustrate this for you, I'm showing you a hypothetical infant toddler classroom in Wisconsin. Per licensing rules, this classroom could have up to 8 children and a 1-to-4 ratio. So that means that for 8 children, you need 2 teachers in the classroom at all times. Most centers are open for more than 8 hours a day, for more than 8 hours a day to accommodate parents' employment. So in this scenario, the center would be open for 10 hours a day. What this means is that in order to cover 2 teachers at all times in this infant toddler classroom, the center would need to pay about 2.5 teachers, which equates to a salary of about $67,500 per year. If you break this down in terms of the cost to each children in the room, this ends up costing about $700 per month per child. But the wages are not the only expense for childcare centers. So they also have to pay for administration, for rent, for maintenance of the building, of classrooms, of outdoor spaces, materials, food, etc. So if we assume generously that that centers spend 70% on teacher salaries and 30% on everything else, this means they would have another about $29,000 to allocate to these other expenses, which break down again to about $300 per child per month. So a child who was attending this classroom, their family would pay $1,000 per month for this care, and that actually breaks down pretty similarly. There we go. Compares pretty similarly to the national cost of infant care, which is about $10,000 per year, and in Wisconsin ranges from about $9,000 to $14,000 per year. So what this example is trying to show you is, again, EC is expensive because caring for children is labor intensive, and we need it to be labor intensive in order for it to be high quality. So when centers want to pay teachers more, they have little wiggle room to increase salaries, to increase wages, and they would have to, pass this on to families. And again, because it's expensive as it is, they really avoid doing that because some families would not be able to afford increased prices. Okay, so before I move on to what do we do about this, I want to just briefly sum up some of the challenges that I've just talked about. So what we've seen, again, in our work in Wisconsin, is that geographic proximity to EC varies widely across communities in the state, tends to be better in more urban areas. The supply of licensed care has been fairly stable over time, but the number of licensed family child care providers has greatly declined. DC workforce is experienced, is educated, and is committed to the profession, but experiences low compensation and challenging working conditions. We think that turnover within the EC field and within programs is likely substantial as a result of this. And this is concerning because these conditions threaten EC providers' ability to provide high quality care, parents' ability to work, and children's development. The good news, though, is that we don't have to, accept things as they are. There are promising strategies for improving conditions in the EC field. So I'm going to briefly talk about that next. Okay. So I'm just going to highlight a few things. I'm going to try to focus on things that we know from research about what is evidence-based and what has promise for making a substantial impact in the sector. So the first thing I want to mention is that there's emerging evidence that financial incentives and increased compensation are effective at reducing teacher turnover, at least in the short term. So in Virginia ran a teacher recognition program that paid EC teachers a $1,500 incentive to remain in the program for an 8-month period. And researchers in Virginia evaluated the impacts of this program, where they randomly assigned teachers to receive the benefit or to not receive the benefit. And what they found was that in this 8-month period, turnover declined by 50%. So this is what this figure is showing you. Turnover in all sites, the control group compared to those who received the incentive in the blue bar, in childcare centers and in school-based programs. So in childcare centers, the turnover declined from 30% of teachers leaving to 15%. So really big, made a really big impact. And the researchers also find that teachers reported that these payments helped them feel appreciated, that their work was important, as well as reduce their financial burden. Again, this is a short-term program, so it's likely that we need longer-term investment and sort of sustain this increased compensation in order to be able to sustain the gains from these incentives. So with that in mind, thinking in the longer term, while financial incentives can be effective retaining teachers in the short term, in the longer term, we likely also need opportunities for reducing barriers to education and career advancement. So what this might look like is rewarding and incentivizing teachers to complete credentials and degrees, and providing comprehensive supports for course and degree completion. So we know that teachers who increase their education and qualifications can help them advance within the sector and to increase their earnings. But teachers who are working full-time in a challenging job, and not just teachers, but in other sectors, right? It's very difficult to combine full-time work with school and with other family or personal demands. So providing, we know from research that providing comprehensive supports like personalized coaching, career support, tutoring, in addition to financial supports, can be helpful to helping workers to complete or advance their education. And research also suggests that we should pay special attention to the challenges of family childcare providers, because these providers are often the only one, they're working alone, so the only ones available to care for children, but need to have a substitute or someone to fill in for them if they're going to be participating in additional training and compensation. And then finally, I think it's important to say that in addition to helping workers increase their education advancement, right, those need to be coupled with increased compensation to reward them for attaining a higher level of education or training. So you may or may not know that Wisconsin has 2 programs that provide additional compensation and scholarships for teachers to do some of these things that I've just talked about. So the Reward Stipend Program provides salary supplements to isECE teachers, with supplements being higher for those with more education and training. And then the Teach Scholarship Program pays for some of the costs of tuition and books and fees for isECE professionals who want to increase their education, and the costs are shared between the scholarship, the teacher, and the employer. But in our study of the Wisconsin workforce, we found that a lot of teachers and family childcare providers had not heard of these programs. So this figure is showing you the percentage of teachers and family childcare providers who had participated in Reward, which are the blue bars, and Teach, without the orange bars. And what I want to point out is that over here, right, we see that 62% of teachers had never heard of the Reward program, and 46% of family childcare providers had never heard of the Reward program. With Teach, we saw substantial numbers also who had not heard of the program, but not quite as high. So this suggested to us that increasing awareness of, and maybe also reducing the administrative barriers to applying for enrolling in these programs might be a good place to start, again, to helping teachers increase their compensation and education. And then finally, I want to mention that paying special attention to family childcare providers is going to be of critical importance for strengthening the EC sector in the state. As I mentioned, family childcare providers have been leaving the field, fewer have been entering the field. One of the reasons that the family providers report leaving the field is that they feel not valued, and like regulations and subsidy systems, quality rating improvement systems like Youngstar are really focused on childcare centers. So all efforts to strengthen the sector really need to think about recognize the unique strengths of family childcare providers, provide additional supports for these providers to ease administrative burdens. So family childcare providers are often working alone, and they're the ones who are caring for kids, buying food, taking care of the paperwork. So easing some of those burdens, would help to make their work a little bit easier and keep them in the field longer. Addressing their economic challenges, as you saw, their wages are significantly lower than those of isECE teachers. So thinking about, how to help them address their economic needs. And then family childcare providers who have, participated in research studies have talked about the importance of peer support and receiving help navigating EC systems as helping them to stay in the field and to prevent them from leaving the field. So things like bolstering shared services networks, providing supports to family childcare associations to help them navigate these systems and help them receive more connected to their peers are also important aspects of bolstering the ECE sector. Okay, so to sum up, 3 key points to take home. So many challenges of the ECE sector stem from low compensation and challenging working conditions, although it's not necessarily all of the only issues. Those are main things that have come up again and again. While these present challenges, there's also big opportunities right now to implement evidence-based strategies for increasing EC workers' compensation and opportunities for career advancement. And the investments in the EC sector that we make will ultimately benefit children's development, will benefit their parents' ability to work, and ultimately the economy at large as well. So I will end there. Thank you very much for your time. I will stop sharing and we can take questions and hear from Ruth, I believe.
Thank you very much, Dr. Pilarz. And before turning it over to Ruth and opening it up for question and answer, I want to just do a brief introduction for Ruth. I know many of you probably know Ruth or have seen her on numerous webinars, but Ruth is the executive director of the Wisconsin Early Childhood Association. And for over 20 years, Ruth has led the Wisconsin Early Childhood Association, which is Wisconsin's largest membership and service organization for early childhood educators. Ruth is a leading voice on both state and national levels for strengthening the early childhood education workforce through policy and system improvement and greater public investment. She serves on Governor Evers' Early Childhood Advisory Council, as well as Congressman Mark Pocan's K-12 and Early Childhood Education Advisory Group. She's also the recipient of the 2019 Community Changemaker Award by the Community Shares of Wisconsin. And today, Ruth will provide some reflections, and then we'll open up for questions and answers. So Ruth.
Thanks, Brandon. And thank you, Alejandra, for the data and the insights that you shared today. I want to start by saying that continued research is incredibly vital as we move forward with making the case for transforming the early care and education system into one that actually works in our state. And it works for the educators, it works for the children and parents, it works for businesses and for our communities. I often go to the Capitol armed with your data when I am meeting with legislators, and it's incredibly important for us as we spin the stories around what's happening with this field. What's unfortunate is that this data should not surprise any of us. For those of us who work in this field, it's a longstanding trend and a reality. It reinforces that childcare is a broken business model, and it's been one for a very long time. Here are the indications of how we know it's broken. Early childhood professionals are undercompensated. That's something Alejandra said quite a bit about. Parents obviously can't be asked to pay any more for care than what they currently are paying. Childcare programs are operating on razor-thin margins that don't allow them to offer adequate compensation. This all then leads to this wage compression that we see and high turnover in this field. Despite, as Alejandra said, these professionals being highly educated, skilled, experienced, dedicated to the important work that they're doing with children every day. These realities illustrate what we need all Wisconsinites impacted by childcare to understand. We cannot continue to under-resource childcare. In fact, childcare needs additional investments to ensure that it remains essential, high-quality early care and education for our youngest learners. It's been a long time for our state and nation to invest in childcare as a public good, which is what it is, much like how we maintain a public system of education or investments into infrastructure such as our roads and bridges. Research shows that children need this high quality early care and education to grow into healthy, productive adults. Some economists point to the proven long-term return on investment when children receive this type of critical early development. As Alejandra said, this is often cited as the best public investment that our state or our nation could be making into children. Equally important is that childcare is absolutely essential for our local, state, and national economies to thrive. It allows parents and caregivers to work, to be productive employees, and for businesses to be profitable and grow. Much of what Alejandra presented on pulls highlights from the early care and education workforce studies, the research which she led and which Department of Children and Families released last fall. In response to the findings, WICA has published a recommendations brief outlining key strategies for moving forward that work towards long-term sustainable solutions. Obviously, strategies don't happen without the funding to support them. Currently, we are not seeing strong investments of state general purpose revenue or the promise of ongoing federal revenue into childcare. I think many of us had some optimism about Build Back Better legislation, which would have had a significant investment in childcare along with standing up the childcare workforce. But at this point, it seems like in order to ensure that any of that happens, we have a huge fight ahead of us as we advocate for any type of legislation like that. Despite that, there's an amazing opportunity to acknowledge the advancements that we have seen because of COVID relief dollars that have supported key strategies for the childcare workforce. When we say COVID relief dollars, I'm collectively referring to over $800 million that have come to Wisconsin dedicated to childcare through the CARES Act, through CRSA, and through ARPA funding. The impact of these relief dollars shows us what happens with childcare when you make significant investments and support it the way it needs to be supported, much like the evidence in Alejandra's research that she presented. WICA's recommendations brief calls for sweeping state and federal investments to support ongoing stability of early care and education and compensation commensurate with K-12 educators for early childhood professionals. Importantly, the state developed the Child Care Counts program as its flagship initiative with COVID relief dollars. It's been an amazing mechanism for getting money out the door and into the pockets of childcare programs, helping to stabilize operations and allowing for increased compensation for early childhood professionals. Our brief also calls for ensuring diversity and racial equity in Wisconsin's isECE programs to ensure that all providers and young children are able to thrive. The Department of Children and Family recently held its first meeting of the newly formed Parent Caregiver Equity Advisory Cabinet. And this month, WICA, with leadership from Dr. Toshiba Adams, is launching a new initiative using narratives to advance equity in Wisconsin's early education workforce. Importantly, we remain advocates for sustaining investments in programs that assist with educational opportunities and rewarding professionals for commitment to the isECE field. Specifically, as Alejandra pointed out, the Teach Early Childhood Wisconsin Scholarship and the Reward Wisconsin Stipend programs. Alejandra spoke about reducing barriers to education and career advancement for early childhood professionals. Wisconsin's recently dedicated $30 million in ARPA funding to ensure that Teach can maximize its impact on credential and degree completion and help to minimize expenses for the individual scholars and for their employers. This investment further will ensure that Reward can reach thousands of individuals with higher stipend rates to help retain professionals in this field. Part of the reason that Reward and Teach are not as well known as we may want them to be is that they also historically have not been funded to the level where we would need them to be funded in order to fully sustain this workforce across the state. So the investment to do this, it'll be vital for us to monitor what we're seeing as the outcomes to this significant investment that Wisconsin is making on these programs so that we can measure their impact on providers and on the field to continue to make the case for long-term investments. I also want to support the focus that Alejandra brings to family childcare. The decline that we've seen in regulated family childcare, and I know there was a question in the chat box that came up while you were presenting about whether certified family childcare was included in this. I don't know if you want to jump in and just.
Sure. Do you want me to right now? Yeah. So that's a great question. We looked at certified providers from 2015 into 2019 only because the way the data change was collected, so we couldn't track it over a longer period of time. But we saw about a 50% decline just since 2015 to 2019 in certified providers. So great. So similar trends as this licensed family childcare, but even since 2015, a significant decline.
And part of the reason this decline is so critical is that in rural communities, we can't support large group centers. And then it's also a way to provide care that reflects cultural diversity and different languages in many of the communities across Wisconsin. The Wisconsin Early Education Shared Services Network is a project that's received ARPA funding also, and it's a mechanism working to support cohorts of family childcare providers in several counties across the state, bringing back office supports and efficiencies to their business, along with supports to eliminate the isolation that family childcare providers often feel. All of this really means advocacy efforts remain critical in moving forward a future where childcare is viewed as a public good worthy of long-term sustained investment. It'll take these types of investments to repair this extremely fragile and broken system. And it'll take collective action to create and push forward and sustain real solutions. Last week, WICA launched Raising Wisconsin, a bold public policy initiative that brings together a broad multi-sector coalition of individuals and organizations pushing for transformational change in childcare and optimal child health and well-being. This initiative builds on long-standing advocacy efforts in our state on behalf of early care and education, with high-level objectives of supporting childcare, commensurate compensation, and a focus on health and well-being of all of our children. Raising Wisconsin's public policy agenda related to childcare includes childcare stabilization, support for the isECE workforce, for families, businesses, communities by sustaining and maintaining programs and initiatives that achieve those goals. You can view that or download that policy agenda at raisingwisconsin.org/objectives. You can also sign up at raisingwisconsin.org for action alerts to stay informed on policy legislation and direct action that you can take and other important updates. We want to welcome more people into this conversation because your voices will be louder and we will be able to carry deeper stories to the Capitol as we are working to bring about change in childcare. This issue can't afford to wait any longer. Hopefully we won't be back 5 years from now with the next iteration of the workforce study saying many of these same issues, but we'll be able to see some change happen. Thank you.
Great. Thank you so much, Ruth. Just a couple of comments. Someone did ask if the resources, the presentation, the recording, and then any of the links that are provided or the programs that are discussed will be supplied. We will have them on our website, and then we of course will share with everyone who's joined us today. So please look for that once everything is ready to roll. If you have other programs, please feel free to drop it in the chat and we will capture those. And before opening up, just a couple of quick questions, and I believe it was for you, Alejandra. There was a question about the data, and so are certified rather than licensed home-based childcare providers included in the statistics that you discussed early on? And if not, how was the decision made? So I don't know if you could address that.
Yeah, of course, happy to. So great question. So when I talked about the supply of licensed care and changes of bed over time, that did not include certified providers. And the reason for that, as I mentioned while Ruth was talking, is the data the way it was collected or reported changed over time. So we couldn't reliably look at that over the full period of time. So we looked at that from 2015 to 2019 only. And we did see a decline of about 50% in the uncertified providers. But then when we did the survey of the Wisconsin workforce, so all of the information I provided about who's in the workforce, what their wages are, their benefits, things like that, that did include certified providers. It included certified and licensed family providers. So a little bit different across the different studies that I talked about.
Wonderful. And again, if you have questions, please feel free to either drop them in the chat or you're welcome to unmute yourself and ask a question. And while people are doing that, there was a question about the programs you mentioned. I believe they were probably the subsidies or the incentives for the workforce. Can you mention those again? And again, they will be in the document, but can you mention what those were?
Yeah, sure. So I'm guessing you mean the Wisconsin specific programs. So I'll start there. But the two that I mentioned are the Teach and Reward. So I'm happy to put the links in the chat, but Reward is, just one word, Reward stipend program. And then the Teach is a Teach scholarship program. And again, those are available to isECE providers in the state of Wisconsin. The other program that I mentioned in my discussion of opportunities for making change in the field was the Virginia Teachers Recognition Program that I'm also happy to put links to the report on that program, but it provided in Virginia incentives to teachers to remain in their childcare center for at least 8 months. And there is a report on that with more information sort of about what that looked like and the impacts that it had. If there's something else, I'm happy to talk about it.
Great. And so I'll pause for a second if someone would like to ask a question.
Brandon, can I just jump in really quickly on the piece about reward for those of you who are early childhood educators on this call? As you know, reward has always had limitations in terms of what level of education you have to be at, how many years of service. With the significant investment we're getting in ARPA funding, everyone who is on the registry at all levels of the registry will be eligible for a stipend. The stipends will be larger amounts paid out until the ARPA funding is gone. So I did want to just encourage you, and it looks like Paula put in the chat box a link to the website where you can find more information about that.
There is a question in the chat that just came in. The question is, are there limitations on how Wisconsin policy and law in place that would limit or prohibit in implementing something similar to the Virginia program?
So I can start. As far as I know, no. So that specific program was, and in the study that I talked about, used money from a grant that was from the federal government to the state in order to improve the EC systems in the state. So they used that initial, this program that was evaluated was funded through that money. But since then, I believe Virginia has now, because they saw this really positive benefits, have found other sources of funding to be able to continue the program. So no, I believe not. And actually, you know, the Wisconsin Reward Program is similar, just implemented differently. So one thing that I will mention about the Virginia program is that one of the reasons I think it was successful is that teachers didn't have to actually even apply for it. So they would verify teachers' employment through the childcare center director. So they would every few months, they would call the director and say, is this teacher still working here? And then they would get their next incentive payment. So they got 3 total payments totaling $1,500 over an 18-month period. So teachers didn't have to do much or really of anything to be able to get that incentive. And I think that's an important piece in thinking about how to increase access to programs, is think about how to reduce some of the maybe administrative barriers or hassles that come with verifying eligibility. And so that was a kind of a unique aspect of that program compared to, I think, how these programs are implemented in many other places.
I have a question about the health insurance. Is that for family child care providers, or is it just one that you can call and do like a Zoom meeting with the doctor?
I don't know the answer to that. I don't know if anyone else here who knows more about health insurance for family child care.
Deb, I know that that through our Wisconsin Early Education Shared Services Network, we offer a telehealth option as part of programs participating in that, family programs, group programs. And that might be what you're referring to. If you're talking more about like the Affordable Care Act and a process of navigation to get more family child care programs onto the Affordable Care Act, there is not a current sort of system in place in Wisconsin that is set up specifically to do that work. Although we have found that both in our state and nationally tends to be one of the best possible solutions for people that are working in this field, is getting care on the marketplace through the Affordable Care Act.
Okay, thank you.
And I'll also kick off, there's a question about the wage cap and reward. With the funding coming in through ARPA, so this 30 million that is going to teach and reward, so far it looks like we're earmarking about 22 to 23 million of that for the reward stipend program, and we will not be following the wage caps that are in place right now for that. That is, or at least that's the recommendation we've made to the department. We're finding out hopefully this week whether all of that's been approved.
I'll say that I'm very excited about all the positive changes to reward that are coming. It's gonna be really exciting to see how this impacts the field.
There is a question from Drew, which is a similar question I was going to ask. Are there good examples in Wisconsin of private and or philanthropic efforts to increase compensation for ECE providers in a defined area?
That is a great question. I'm sure there are. I don't know specifically of what is locally is happening. I don't know if Ruth, you have.
I'll just reference a couple things. So this isn't necessarily private, but several counties or municipalities are taking a portion of their local ARPA recovery funds and putting it towards stipend payments for the workforce. So Milwaukee is putting $5 million into stipend payments for people that work in childcare. Jackson County is putting $105 million into it, or $105,000 into it, not million. They wouldn't have that many people in Jackson County. So there are some counties that are doing those types of things. The other thing that I think is important to know is about the model in Partner Up. And so Partner Up, I think to me, what is interesting and what will be really useful to look at in terms of Partner Up. So this is this public-private program that started with funding, again, joint finance approved with CURSA and ARPA funding. And it's a way that businesses can provide supports for their employees for childcare supports, where businesses have to pay about 25% of the rate, and the grant itself pays 75%. To me, the most interesting part about this project is that it's going to give us an opportunity to look at what happens when you pay the actual cost of care. So unlike the data that Alejandra presented about what happens in an infant room when you have a family paying $10,000 or $12,000 a year, with Partner Up, the fee that is paid through that fund is set at the true cost of care. So for an infant, it's set at $1,800 a month instead of $1,000 a month. So I think it'll give us this opportunity to see what happens and what's transformative in childcare programs when they're able to receive those types of revenue for the care that they're providing.
I believe I put the right link in the chat for the Partner Up program. So great. Other questions? The one just came in through the chat. On the trend of decline of family-based providers, was the trend specifically on providers dropping out, parents wanting center-based care, or people living further away from their own families and not being able to utilize them?
Yeah, great question. So I think it's hard to say, because what we see, right, is the number of providers operating, family providers operating, the number of children that they're serving. And what I showed you in terms of provider openings and closings suggests that it's both providers closing their doors and then fewer new providers entering the field. So fewer family childcare providers starting their business. In terms of parents, in terms of what parents are doing, it's hard to say whether they're wanting center-based care or whether family providers are closing and then they're moving into center-based care, even though they would prefer a family provider. We actually don't have good, very good data on the state or local level on what parents are doing for childcare. We are planning, as part of the project, research project I mentioned, serving parents in about a year or so to try to find out more about what parents' preferences are in the state and what they're doing for care. But it's possible that some of this is changes in parents, what parents wanting to do. It's also quite possible that, you know, it's parents being unable to find providers that they want, that are available to them. So and that's not a very concrete answer, because it's hard to say right now with the data that we have. But I hope you know, we can speak more to this soon.
What's hurting our family daycare in our town is we have 3K every day, all day. So that limits family childcare providers, how many kids they can take, because you're limited to babies and all that. So I think that's one big problem. Yeah,
one thing we know definitely from there's been studies in other states that have looked at the impact of pre-K expansions, public pre-K expansions on the childcare sector. And so what we know from other states is that there's often sort of unintended consequences of expansions in pre-K, because, like you said, either you know, kids move into pre-K and out of private centers or family childcare, or centers, if pre-K is allowed in centers and private centers, like centers shift towards providing more services to 4-year-olds and fewer to infants and toddlers. And so like you mentioned, Deb, for family childcare providers, if they were only serving infants and toddlers, it's very expensive, and they might not be able to cover their costs, right? And the amount that they can charge families with infants and toddlers, because like I mentioned, these ratios, right, are much more strict and for the younger kids. So yeah, that's a great point. I think what we're seeing from other states, and we think might be going on in Wisconsin too, is that expansions in pre-K could negatively impact the sector as well.
I just want to put out there, Deb, also in response to that, that one of the things that I think we were super hopeful about with Build Back Better is that on top of the investments in childcare specifically, so for that sort of 0 to 3 range, there is funding for this universal funding for preschool for 3 and 4-year-olds, and a requirement to do it in a mixed delivery model, right? So the model that Wisconsin has, which includes some mixed delivery, but is not exclusively in a mixed delivery kind of model, takes the 4-year-olds, which in childcare, we sort of call them the bread and butter of childcare. You can have more 4-year-olds in a classroom than babies. And they can bring in revenue for you to offset the losses that you're taking in infant care. So we were super hopeful that we'd see something like that happen with Build Back Better, so that we could actually see more childcare getting into the lane of doing more preschool and paid preschool in Wisconsin. But right now, Build Back Better is very out of reach, it appears, within our political system.
And I'll just quickly add to that. Thank you, Ruth. To say that it's not that this implies, right, that public pre-K is bad and we shouldn't expand it, but just that we need to make equal investments for infant and toddler care and to support those providers who are not eligible for public pre-K funding to be able to provide them with additional funding for the children that they're caring for. So.
Wonderful. And we are at the hour, so I do want to be respectful of everyone's time. And just the final thank you to Alejandra and Ruth for sharing your research and input into this topic. And as I mentioned before, there will be a follow-up email that will include the recording when it's ready, PowerPoint presentations, and then any links that were mentioned from today as a resource. So thank you all for joining us, and I hope you have a wonderful day.
Thank you so much. Pleasure to be here.